Yeah, I'm so happy to be able to speak to Think Talk Treat Migraine because it's a program that's very close to me as I'm one of the team members that has been hard at work at trying to make this program successful. And I'll tell you what I love about Think Talk Treat Migraine is the fact that it is completely disease specific, so it has nothing to do with any one particular medication or any one particular treatment. And it has everything to do with addressing unmet needs in migraine care or clinical care gaps, as we like to call it. And so, uh, first, to really identify where those gaps are coming from, we have a study called Overcome, which is the largest study of its kind to sample over 60,000 people to figure out where are the deficits in migraine care. And what we found was that there's a huge unmet need in terms of people that are not getting diagnosed with migraine, that have migraine, and a huge unmet need in people who are eligible for treatment that are not getting it. And going back to the question that you had about headache specialists, I think it's easy for a lot of people to assume that this is a primary care problem, and that once we get to the headache specialist or the neurologist level, that those problems go away. And what we found is that they just don't. So interestingly, uh, in a neurology practice and in a headache specialist practice, 56% of people who are eligible for preventive treatment, just based on the impact that they're experiencing of their migraine and the number of headache days that they have, 56% of those eligible people are not getting the treatment that they need. And a secondary issue that we identified was that half of people in these visits are not being asked about or discussing the impact of migraine on their life. And the reason that that's important is because it's impact that brings someone in to see their provider in the first place, and impact is typically what drives a provider to take action with some type of treatment. So that's why those two numbers are especially relevant. And not to go on too long, I'd love you to get to some of the questions that you have about the program. But what's nice about the program is that we've engaged in a number of contacts with both people with migraine and providers who treat migraine, and trying to get them to do just a few simple things. Number one, to identify migraine when they see it, and there's some easy screening tips for finding migraine. In that, if someone comes in with a headache and they come in with a headache that also results in nausea, some degree of impact on their life, and light sensitivity, there is an extraordinarily high likelihood that that person is experiencing migraine. So without even having to go into enormous detail, just those three screening questions can yield just an incredible amount of information as far as diagnosis goes. Once the diagnosis is considered, then asking about impact. How many days in a month is migraine impacting your life, in that it's making it difficult for you to get out of bed in the morning, go to work, spend time with your family, meet social obligations? And this has nothing to do with the number of days that they're experiencing, but the number of days of impact. And if those number of days is 4 or more, then that's an individual that is potentially a candidate for preventive therapy. And so that's really the second issue that we're trying to address.